I think that's one of the key differences is the uncertainty, because you never know exactly what you're dealing with all the time, and this fact that things are undifferentiated, and you sort of develop a plan with the patient and try and get to some sort of diagnosis sometimes. And it may be that you can't always deal with it. You may have to pass it on to a more experienced GP colleague. They may need referring on to a specialist for some reason as well.
So I'd say it's very much more officey based, where like a GP would be in your own clinic room. I feel like you'd work more independently rather than in a big team. And I think slightly more flexible as well, where as long as you get the work done, you have scope to either look at something else or focus on something else.
You're also gonna interact with patients a little bit more here, especially on the phone when you're talking to them about their medication. So here you can really hear a patient's queries or issues or anything, and you can kind of resolve it like straight away, rather than when you're in a pharmacy, you kind of have to talk to the GP.
In community, it's more like general advice, but I feel like in GP practice you can actually make the biggest change in GP practice, where you can actually have a direct impact for patients' health, and you can build that long-term relationship with them as well.
Community pharmacy still is the one where we are in touch with the general public, because we also sell medication to people. So you will get to see predominantly the whole community in your area. Very more complex patients, they will probably be seen at hospital, and they'll be seen by the hospital pharmacists. Anything that's more than a minor ailment, you will probably see the patient start at the GP surgery, where our colleagues, the IPs, would probably see those pharmacists.